So Dan, this is a meeting of health centers from around the world. You're from the U.S.
Yes.
You're in Canada. I think at first blush people would say U.S., Canada, man, there couldn't be more differences between the health systems.
Oh, but there are such similarities between and among the health centers in Canada and in the U.S. Both are focused on populations in great need and who are marginalized by the rest of the healthcare system. They're really what we call medically disenfranchised. They're immigrants, they're low income, they're people of color. In America, they're people without insurance coverage. And these are the people who have the greatest barriers to access to care. And even in Canada, the thing that is so enlightening to us is that in a country like Canada with universal coverage, there are people who struggle to be able to get access to the care they need when they need it, when it makes the most sense, because of who they are, where they are, the kind of work they do, the health conditions they have, where they came from.
And I mean, to Canadians, that sounds like the American system for everybody.
It does. Right. It does. In America, there are multiple additional barriers to care. Right. Lack of insurance. We've got almost 60 million people who are uninsured, and that is the hugest barrier, but it's a financial barrier. Here in Canada, it might be language, culture, geography. It might be living in a rural community, so therefore distance to care. It might be other kinds of factors that get in the way of people getting the care they need. In the U.S., it's all of that plus the barrier of not having a payer that's ready to pay for your care. But all of those are barriers to care, and we have to figure out a way to overcome them.
So what do you hope to get out of this conference in the next couple of days?
I'll tell you, the Canadian health centers have much to teach us. In particular, the community health centers here in Canada have done so much to wrap around the medical and other healthcare services they offer. Services that relate to the particular social determinants of health, housing, education, employment, nutrition, and other factors that affect the health of a whole population, a whole community. We in the U.S. are doing some things in that regard, but we don't begin to match what the Canadian community health centers can do. And that is something they can teach us, and we want to learn that.